Now let's go to location methods and tune measurements. This time we talk about the anterior and lateral aspect of the thorax and abdomen. Clavicle forms the connection between the shoulder girdle and the thorax. It separates the major and minor supraclavicular fossae with stomach 11, stomach 12, and Ching-P. From the rib cage, located on the lower border of the clavicle, are stomach 13 at its midpoint and kidney 27, two tune lateral to the midline. The suprasternal fossa forms a depression superior to the sternum between the sternoclavicular joints. It is the location of REN 22. For anatomical orientation of the ribs, the midsection of the clavicle is a good starting point. The first rib lies directly below the clavicle, forming a narrow bow. It articulates with the manubrium just inferior to the sternoclavicular joint. Please note the following when palpating the ribs and intercostal spaces and locating the respective acupuncture points. From their articulation with the sternum, the ribs run initially horizontally or in a gentle curve in an inferior direction, while at the lateral aspect of the thorax, they assume a superior direction towards the posterior aspect of the body. Inferior to the 4th, 5th intercostal spaces, the medial sections of the ribs merge with the costal cartilage so that the intercostal spaces do not extend very far medially. Therefore, it is necessary to palpate somewhat more laterally. First rib, first intercostal space. By palpating parasternally in an inferior direction, the first rib can generally be felt directly below the clavicle. Here, kidney 27 is located two tune lateral to the anterior midline. Below follows the first intercostal space, then the second rib, and so on. REN 20 is located on the anterior midline at the level of the first intercostal space. REN 21 is located slightly superior to it. Second rib, manubriosternal synchondrosis, the manubriosternal junction. The synchondrosis is usually a clearly defined transverse bony structure on the superior section of the sternum, level with the articulation of the second rib. Directly below the synchondrosis is the second intercostal space, from where subsequent ribs and intercostal spaces can be counted by palpation. The lateral superior aspect of the thorax is bordered by the clavicle and the deltoid muscle, with the coracoid process deep to the latter. The deltopectoral triangle can be located by palpating from the end of the anterior axillary fold along the border of the deltoid muscle towards the shoulder and the lower border of the clavicle. Here in the center of the triangle lies lung 2. Laterally, the triangle is bordered by a clearly palpable bony structure, the coracoid process. In order to distinguish the process from the lesser tubercle of the humerus, the arm is rotated externally with the elbow flexed at the same time. While the process will remain fixed, the tubercle will follow the movement. Lung 1 is located slightly superior and lateral to lung 2 and medial to the lower border of the coracoid process. The contours of the deltoid muscle and the deltopectoral triangle can be emphasized through muscle flexion, for example, by pressing the hands against each other in front of the chest.